Many women experience pain during their menstrual cycle. This is known as dysmenorrhea. It's a common condition. Dysmenorrhea can range from mild discomfort to severe pain. This pain can make it difficult to do everyday activities. Dysmenorrhea is a very real medical condition. It is not something to be ignored or dismissed. If you are experiencing painful periods, you are not alone. There are many things that can be done to help. It's important to understand the different types of dysmenorrhea. This will help you get the right treatment. There are two main types, primary and secondary dysmenorrhea. We will discuss both types in detail. Understanding your body is the first step to feeling better. Primary dysmenorrhea is the most common type. It is not caused by any underlying medical condition. This type usually starts a few years after a woman begins menstruating. It's often linked to hormonal changes during the menstrual cycle. These hormonal changes can cause strong contractions in the uterus. These contractions help shed the uterine lining. However, they can also lead to pain and discomfort. Secondary dysmenorrhea is caused by a medical problem. This could be a problem with the reproductive organs. Examples include endometriosis, fibroids, or pelvic inflammatory disease. This type often starts later in life. It may also cause other symptoms along with pain. These symptoms can vary depending on the underlying condition. Primary dysmenorrhea is primarily caused by certain chemicals in the body. These chemicals are called prostaglandins. Prostaglandins are naturally occurring substances. They play a role in pain and inflammation. During menstruation, the uterus contracts to shed its lining. Prostaglandins trigger these contractions. However, high levels of prostaglandins can cause intense contractions. These can lead to severe pain and cramping. Other factors can contribute to primary dysmenorrhea. These factors include stress, smoking, and a family history of painful periods. It's important to be aware of these factors. They can influence the severity of your symptoms. Secondary dysmenorrhea, unlike primary, has specific causes. These causes are often related to underlying medical conditions. Identifying these conditions is key to effective treatment. Endometriosis is a common cause of secondary dysmenorrhea. This occurs when the tissue similar to the lining of the uterus grows outside of it. This misplaced tissue can cause pain, inflammation, and scarring. Uterine fibroids are another possible cause. These are non-cancerous growths in the wall of the uterus. Fibroids can cause heavy bleeding, pain, and pressure on the bladder. Pelvic inflammatory disease, or PID, is an infection of the reproductive organs. It can cause pain, inflammation, and scarring. This can lead to chronic pelvic pain and infertility. Section 5. Symptoms of dysmenorrhea. Dysmenorrhea manifests through various symptoms. The most common symptom is pain in the lower abdomen. This pain can be severe enough to disrupt daily activities. It often begins a few days before menstruation and may last for several days. The pain may be accompanied by other symptoms, including back pain, nausea, and headaches. Some women also experience diarrhea or constipation. In some cases, the pain may radiate down the legs. These symptoms can vary in intensity. Some women experience mild discomfort, while others experience debilitating pain. Understanding your symptoms is important, as it helps you describe your experience to your doctor. This leads to a more accurate diagnosis and treatment plan. Section 6. Over-the-counter relief and hormonal treatments. Managing dysmenorrhea involves various approaches. Over-the-counter pain relievers are often the first line of treatment. These medications, like ibuprofen or naproxen, can help reduce pain and inflammation. They work by blocking the production of prostaglandins. Another effective treatment option is hormonal birth control. Birth control pills, patches, or rings regulate hormones. This can reduce the production of prostaglandins. This often leads to lighter periods and less pain. These treatments are generally safe and effective. However, it's important to consult with your doctor before starting any new medication. They can help you choose the best option for your specific needs. They can also monitor you for any potential side effects. Section 7. Lifestyle changes and alternative therapies. Alongside medical treatments, lifestyle changes can help manage symptoms and improve overall well-being. Regular exercise can be particularly beneficial. Engaging in physical activities like jogging, running, or even brisk walking releases endorphins. Endorphins are natural pain relievers that can elevate your mood and reduce discomfort. Exercise can also significantly reduce stress levels, which is crucial because stress can exacerbate period pain and other symptoms. Applying heat to the lower abdomen is another effective method for pain relief. A heating pad or hot water bottle can help relax the muscles and ease cramps, providing a soothing effect. Additionally, a warm bath can be incredibly soothing, helping to relax the body and mind. Some women find significant relief from alternative therapies, which can complement traditional treatments. These alternative therapies include practices like acupuncture and the use of herbal remedies. Acupuncture involves inserting thin needles into specific points on the body, a practice believed to stimulate the flow of energy. This stimulation may help reduce pain and inflammation, offering a holistic approach to managing symptoms. Gentle exercises like Tai Chi and yoga can also be beneficial, promoting flexibility and reducing stress. Herbal remedies, such as ginger or chamomile tea, may also offer some relief. These natural options can be soothing and help alleviate discomfort. Ginger is known for its anti-inflammatory properties, while chamomile can help relax the muscles and calm the mind. Keeping a journal to track symptoms and lifestyle changes can also be helpful. It allows you to identify what works best for you. Mindfulness and meditation practices can further enhance your well-being, helping you stay grounded and focused. By incorporating these lifestyle changes and alternative therapies, you can take a proactive approach to managing your health and improving your quality of life. Section 8. Surgical options for severe cases. In some cases, surgery may be necessary. This is often a difficult decision and is usually considered only after other treatments have failed to provide relief. The decision to undergo surgery is not taken lightly and involves thorough consultations with healthcare professionals. This is typically considered for women with severe dysmenorrhea that hasn't responded to other treatments. Severe dysmenorrhea can be debilitating, affecting daily activities and overall quality of life. When pain management, hormonal treatments, and other non-invasive methods fail, surgical options may be explored. It is also considered for women with secondary dysmenorrhea caused by underlying conditions. These conditions can include endometriosis, fibroids, or pelvic inflammatory disease, which can exacerbate menstrual pain and require more targeted interventions. One surgical option is laparoscopy. This procedure is often used for both diagnostic and therapeutic purposes. It allows the surgeon to see inside the abdomen and pelvis, providing a clear view of the reproductive organs. This is a minimally invasive procedure. It involves making small incisions, which reduces recovery time and minimizes scarring compared to traditional open surgery. It allows the doctor to view the reproductive organs and diagnose conditions like endometriosis. Endometriosis is a condition where tissue similar to the lining inside the uterus grows outside of it, causing pain and potentially leading to fertility issues. During laparoscopy, small incisions are made in the abdomen. Through these incisions, a laparoscope and other surgical instruments are inserted to perform the necessary procedures. A thin, lighted instrument called a laparoscope is inserted to view the organs. The laparoscope transmits images to a monitor, allowing the surgeon to see detailed views of the internal organs and perform precise surgical actions. Other surgical options include myomectomy and endometrial ablation. These procedures are chosen based on the specific needs and conditions of the patient. Myomectomy involves removing uterine fibroids. Fibroids are non-cancerous growths that can cause heavy menstrual bleeding, pain, and pressure symptoms. Endometrial ablation removes or destroys the lining of the uterus. This procedure is typically used to treat heavy menstrual bleeding when other treatments have not been effective. These procedures can reduce heavy bleeding and pain. They offer significant relief for many women, improving their quality of life and allowing them to return to normal activities. In some cases, a hysterectomy may be recommended. This is a more extensive surgery and involves the removal of the uterus. This involves removing the uterus. A hysterectomy is considered a last resort and is typically recommended for women who have completed their families or when other treatments have failed to alleviate severe symptoms. It's typically a last resort for women who have completed their families. The decision to undergo a hysterectomy is significant and requires careful consideration and discussion with healthcare providers to understand the benefits and potential risks. Section 9. Conclusion and consultation advice. Dysmenorrhea is a common condition that affects many women worldwide. It is characterized by painful menstrual cramps that can range from mild discomfort to severe pain. This condition can significantly impact daily life, making it difficult to carry out everyday activities. It affects women of all ages and backgrounds, and the intensity of the pain can vary greatly from one individual to another. Some women may experience only mild discomfort, while others may suffer from debilitating pain that interferes with their daily routines. The pain associated with dysmenorrhea can be sharp, throbbing, or a dull ache. It often begins just before or at the start of menstruation and can last for several days. For some women, the pain is so severe that it can lead to nausea, vomiting, and even fainting. This pain can significantly impact daily life, making it challenging to attend work, school, or social activities. It can also affect a woman's emotional well-being, leading to feelings of frustration, anxiety, and depression. Fortunately, there are many effective treatments available to help manage the pain of dysmenorrhea. Self-care measures, such as applying a hot water bottle to the abdomen, can provide relief for some women. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can also be effective in reducing pain. In addition to self-care measures and over-the-counter pain relievers, some women may benefit from lifestyle changes, such as regular exercise, a healthy diet, and stress management techniques. These changes can help reduce the severity and frequency of menstrual pain. For women who do not find relief from self-care measures and over-the-counter medications, prescription medications or hormonal therapy may be necessary. These treatments can help regulate the menstrual cycle and reduce the severity of pain. In some cases, surgery may be necessary to address underlying conditions that contribute to dysmenorrhea, such as endometriosis or fibroids. Surgical options can provide long-term relief for women who have not responded to other treatments. It's crucial to consult with your healthcare provider if you experience severe or persistent menstrual pain. They can help determine the underlying cause of your pain and recommend the most appropriate treatment plan for you. Your healthcare provider may perform a physical examination, review your medical history, and order diagnostic tests to identify any underlying conditions. This comprehensive approach ensures that you receive the most effective treatment for your specific situation. Once the underlying cause of your pain is identified, your healthcare provider can recommend a treatment plan tailored to your needs. This may include a combination of self-care measures, medications, and lifestyle changes to help you manage your symptoms and improve your quality of life. Remember, you don't have to suffer in silence. There is help available, and you deserve to live a life free from period pain. Reach out to your healthcare provider and explore the treatment options that are right for you. With the right support and treatment, you can take control of your menstrual health and enjoy a better quality of life. Don't hesitate to seek help and take the first step towards a pain-free future.